Hello, my name is Professor Mary McCarran and I'm the Principal Investigator of the Intellectual Disability Supplement to the Irish Longitudinal Study in Ageing, better known now, of course, as Ids-Tilda. And Ids-Tilda was established in 2008 with the aim to identify the principal influences on ageing for people with an intellectual disability who are aged 40 years and over in Ireland. And this is the first nationally representative longitudinal study of ageing in people with an intellectual disability, where we have the ability to compare to the general ageing population. So the study really seeks to understand and characterise the changes in ageing by examining healthy and successful ageing, by looking at what are the determinants of health and longevity, and then looking at the similarity and differences between people ageing with and without an intellectual disability with the data yielded from Tilda. And this, of course, will assist us and support us in developing evidence-informed policies, practices and evaluation. There's a very robust and strong conceptual framework which underpins Ids-Tilda, and this is really to ensure that we had a broad scope of data and which would allow us to describe the impact of ageing for this population across a diverse range of life domains. So we talk to people about their day-to-day lives. We talk to people about relationships. We talk to people about their physical health, their mental health, dental health, bone health. We also are very interested in talking to people around their community connectedness, how involved they are in the community, what are the barriers to community participation. Ids-Tilda also includes a health fair. So we measure people's blood pressure, we measure their height, their weight, we take samples of hair and blood and other various biomarkers to help us understand ageing and other health indicators. And we also have a separate but linked study where we interview family carers who are supporting people who are ageing with an intellectual disability who continue to live at home. And this is really important because many of the family carers are themselves ageing and they're dealing with their own health concerns. So it is really important that we understand what are the issues for them and what supports do they need to continue supporting their loved one to live at home if that's what they both would like to do. And we also have an end-of-life component to this study, and that's where we interview staff or family carers who have supported people who are participants in the study who have since passed away. But this study was developed in very close cooperation with people with an intellectual disability themselves. So as far back as 2006, when we began to think about developing this study, we worked with people with an intellectual disability. And at the beginning, people felt that people may not be able to participate in a study of this nature, that it would be too difficult. But I really believe that it was our involvement and work with people with intellectual disability from the beginning that made this study possible. So people were involved with us at the very beginning in the production of the easy read materials that would support inclusion, that would empower people to partake in a meaningful way. So they helped us to generate additional questions that wasn't included in the original Tilda protocol, but they considered were very important to their lives. And we held numerous focus groups with people throughout the country to get a better picture of questions and issues that were really critical to their well-being and their health as they grew older. And they then assisted us with the development of materials to support dissemination, to make sure that the findings were accessible to people with an intellectual disability. And we have produced series of short films and videos, and this has been truly wonderful. And now people with an intellectual disability, some of our participants, are involved in training of our field workers, and they're assessing how well they're able to deliver the protocol, and most importantly, the critical communication skills that really is required to involve people with an intellectual disability in a study of this nature. And they're also involved, of course, in our various committees, our scientific committee and our steering committee. And we have been pleased to maintain and grow our keeping in touch strategy. And we feel this has been fundamental, I think, to the overall success of the study over the 12-year period. So we have regular newsletters, we have regular cards, we send out a call to our participants to submit various pictures and artwork for various competitions. So our Easter card, our Christmas card. And this year we had over 776 Christmas cards submitted for a Christmas card competition. So this really tells you how important this element of the study is for people with an intellectual disability. And it's critical to give them a sense of belonging and a sense of ownership of the study. And over the 12 years, we have had approximately a 96% retention rate. And this didn't happen by accident. I think this happened because of the involvement of people with an intellectual disability from the beginning. But during the past year, we were completing wave 4 of Ids-Tilda. And as we all know, 2020 was a year like no other. The COVID crisis in Ireland and worldwide has been very hard for everyone. Many have lost loved ones, many have contracted the virus and are perhaps struggling to recover from it. And many are dealing with the impact of the social isolation, of the restrictions imposed to try to curtail this pandemic. And it has had serious impact on overall health and well-being. And people with an intellectual disability and their families have also had serious impacts from the COVID pandemic and adhering to the guidelines, the same indeed as the rest of society. And in many cases, people were severely impacted by the closure of what really was for them essential services. Many people struggled with being unable to see their family or friends. And Ids-Tilda was also impacted during the pandemic. We were in the middle of wave 4 data collection and we had to suspend that for a number of months. But the team responded by adopting our approach and we completed our data collection using remote interviewing, telephone or Zoom calls. And this indeed proved very successful. And we completed wave 4 in September 2020 and we had 739 participants, which was really great. But we also took this opportunity to ask participants some additional questions about COVID-19 and how the crisis affected their lives. So we wanted to explore the relationship between the disease and other health and well-being issues for people, and to try to understand better what were the potential predictors of symptoms and infections and the difference in the people's lives before the COVID crisis and issues for them post-COVID. And we found that at the end of September, when we finished data collection, almost 2/3 of people enrolled in this study had been tested for COVID. And that there was only 14 people that were not able to tolerate the testing, which is really excellent. But out of the over 400 people that were tested, only 11 people tested positive, and that is really remarkable. And we had no people with an intellectual disability who were enrolled in the study who were lost, who died during the COVID crisis. Almost 8 out of 10 participants said that they had a plan in place to manage self-isolation according to public health guidelines, and there was evidence of policies and procedures in place within services as well. And I think that this preparation and this adherence to the guidelines by individuals themselves, by families and services speaks volumes to how well this population responded to the crisis, with resilience and with resolve. And especially considering that the majority of these participants who were older, and they had at least one health condition that would really have resulted in poor outcomes for them if they were to contract COVID-19. However, The COVID-19 crisis was a major source of stress and anxiety for over 50% of our participants. Many people miss doing their usual activities. Many people miss seeing their family, miss seeing their friends, miss getting out, the same as all the rest of us. And they were worried about catching COVID-19 or worried for their family members. And many reported feeling lonely and feeling isolated. But there were also some positive aspects to COVID-19 during this period. And some people reported having more time to learn new skills, to do activities that they haven't had a chance to do before, to have more time to spend with staff and better quality of time. And many people learned technology and gained a lot of skills in the area of using Zoom and other technology, something that they previously hadn't the skills to do. And this will really create great opportunities for them going forward in keeping contact with people who they don't live with. And our findings show that people with an intellectual disability and their supporters and families responded really well to the COVID-19 crisis. They demonstrated a wonderful sense of creativity and resilience, even when faced with the threat of COVID-19 and the challenge caused by the social isolation, the restrictions and the closure of services. The findings from Ids-Tilda survey have added to our understanding of COVID-19 and how it has affected people with an intellectual disability in Ireland. And as future waves of this pandemic, which we're currently in a second wave of this pandemic, it will enable us to continue to follow and to track poor outcomes, if there are, for people with intellectual disability and those who are at risk of poor outcomes. So we'll continue to follow this population going forward. Our COVID report will be up on our website at the Trinity Centre for Ageing and Intellectual Disability, and we will be publishing, and all our previous reports are available and can be accessed from that site, as will additional papers which will be coming through in 2021. So I really want to thank the Ids-Tilda team and particularly Professor Philip McCallion, who has been with us from the very beginning of this study and is a co-applicant, but all of the team who have been just a wonderful job in making this study a reality. I particularly want to thank our participants, our families and all of the carers and services. I want to thank the Ids-Tilda Steering Committee and the Scientific Advisory Committee, and I want to, of course, thank our funders, the Department of Health and the Health Research Board.